right, folks, good morning. Today is June 28th, 2024. This is Coffee with Community Services, Alta California Regional Center's weekly service provider meeting. Thank you very much for joining us today. We'll start with some staff introductions and then we will get into our agenda. So from Alta California Regional Center, I see from our Community Services Department,
Like John froze. Give him just a second here. Thank you guys for your patience.
our manager Helen is on. Good morning, Helen.
John, you're bouncing out. Your connection was a little spotty there.
I saw
Okay.
that,
Okay.
so I just stopped talking completely until everyone unfroze. All right.
Okay.
So where I was at was I was introducing Michael. Good morning, Michael. And I also see Michelle on, our manager. Good morning, Michelle. And Tom is on from Community Services, and Dan, and Scott and Rhonda on. Good morning, and Christine and Belinda and Jessica as well. And I see Rihanna. And our manager Jordan is on. Good morning, Jordan. And I see Beverly and Christy from Community Services. Our directors from Executive Management are here. I see Michelle Johnson and Camelia on. Good morning. And from Client Services, I see Veronica is on. Good morning, Veronica. And also from Community Services, I see Ethan and Jolana. Good morning. I see Hubert. Good morning, Hubert. It's going to be a hot one. Maybe Hubert will let us know how we can stay cool in the heat because it's going to be ridiculous apparently next week everywhere, but definitely in the Sacramento area. So good morning, folks. I see my assistant Zach is on as well. Our Associate Client Services Director Tracy's on. I am now going to throw it over to Jordan, who's going to go over our agenda for today.
All right, folks, happy Friday. So first on the agenda will be Deaf Culture and Sign of the Week. That will be presented by Michael. And then John is going to give us a budget update because it is the last week of our fiscal year. Yay. And then we're going to have a vendor spotlight. Academics Academy, Brittany Harris has joined us. Scott is going to give us some HCBS updates. And then I'm going to actually be sharing an event that Turning Point Start is going. It's a free training series for caregivers. So I'll be talking about that. I'm also going to give you guys an update on our community placement plan and community resource development plan contracts that we have awarded and have finalized. And then John can get into the events calendar and any other topics that you guys might have. And just a friendly reminder, we are not having coffee next Friday. So mind folks for that.
It will be too hot for coffee next Friday. All right, I am now going to spotlight Michael for our sign of the week and for our Deaf Culture 101. And I'm hoping, Michael, you would not mind just briefly sharing about the activities that we had this week as well. I know we had both the Being Michelle premiere at the Crest Theater, and we also had our vendor forum that was here this week too. So hopefully you can share briefly about those two things as well. And I will throw it to you and spotlight you.
Perfect. Hello and good morning, everyone. This week's sign of the week. Next week is the 4th of July, so we're getting pretty excited about that. So you might be curious about some signs related to the 4th of July. So this week we have the sign fireworks. Now, there are several different ways you can sign this, but I'm just going to give you one example for today. So what it looks like is this. You do this multiple times with your fists and then you bring them out. So you use the S hand shape, stack your fists this way, and then bring them out into the 5 hand shape like this multiple times. Because that typically represents what fireworks look like as they're going off. So happy July 4th, everyone. So now in regards to Deaf Culture 101, before we jump into that, I wanted to, we all use idioms often, and there are idioms specific to deaf culture that are metaphoric. However, most idioms are based on English and, like break a leg and good luck. But for deaf culture, we have our own idioms that are not based on English, which is interesting. And this is actually something that is very cherished among the deaf and hard of hearing people. And we communicate through these idioms. They're based on shared experiences. So I'm going to give you 3 examples. The first one, which is the most common among deaf and hard of hearing people, is the idiom for train gone, which is similar to like you missed the boat, which means if a person had arrived late somewhere and somebody there was a conversation that they had missed and they're like, oh, what would they say? What did they say? Train gone, sorry. And that is, yes, it means you missed the opportunity to get that information. Or maybe there was a distraction and nope, we can't repeat that. Train gone, sorry. You'll see this very often. It is a famous idiom that is used quite regularly. The second one we have is touch finish. Touch finish, which basically means been there, done that. I've gone there, I've done that, been there, done that. Touch finish. So maybe you ask somebody, have you gone to a restaurant? Touch finish, meaning, yes, I've been to that restaurant. So third, we have one that's fun zero, which means not funny, a lack of humor. Fun zero, but the zero is kind of dramatized like this. And so, in English, they say break a leg. And so in sign language, we've actually adjusted that to say break your fingers. So we sign break your fingers to mean good luck. All right, and now for the YouTube sign of the week practice, I'm going to go ahead and put that in the chat now. The link for that is available. So now 2 things I wanted to share with you per John's request is the Deaf and Hard of Hearing Vendor Forum. That was a hit. We had several attendees, several presentations, and rich discussion where we saw people learn a lot about deaf and hard of hearing communication barriers, what's needed within the community, and what goals our vendors can accomplish with partnership, and how services for the vendors can improve. And we also wanted to meet again to see how the services have improved after these discussions. So I really enjoyed the presentation from Melinda. She did great. She provided a brief presentation, and there was a great discussion after that, which was very pleasing to see. Now, for the Being Michelle premiere, I had to add an E at the end of that. So the theater was set up and we worked out several details to make sure the timing was right, interpreters were available, the seating for the interpreter was available, and so that those using the interpreters can access that. There was almost 500 people who attended this event, which is fantastic to see so many deaf and hard of hearing people. There were legislators, there were people from different agencies, all came to watch this premiere, which is, I mean, it's inspiring to see, and for everyone to come and watch the struggle that had been shared by Michelle within the justice system. There were 3 panels. The first panel focused on the experience as it relates to the criminal justice system. And the second one was how to approach change within the agencies. As you can see, there's pictures being shared here of these panels happening. Thank you for sharing those pictures. Those were great. I kind of missed some of them, but anyway, So there was also another panel. So, and Jordan was on one panel where the discussion was really to make sure that we see clients with developmental disabilities, and those that we serve with Alta, and how Alta can be involved and supportive before these clients experience additional trauma within the criminal justice system. So it was a fantastic experience. I really appreciated the turnout and the rich conversation that we had as a result of that.
Excellent. Thank you, Michael. Jordan, do you want to share at all about your experience? I know I showed a picture of you up there on stage at the Crest Theater. Not an easy thing to sit on a panel in front of an audience in a big theater, is it?
No, but it was a great opportunity. I got to speak about the role of the forensic specialist, and our forensic specialist is currently Megan Qualick. I had the pleasure of being our forensic specialist for about 8 years, and it's such an important role that we have here at the regional center, right? To really make sure we're involved in our client's criminal justice case, to really just make sure we're working with the defense attorney that they get due process, right? And they're understanding the criminal proceedings against them. So it was a great opportunity for me. I actually hadn't been to such a large event with the deaf and hard of hearing culture, so it was just really eye-opening to me. I'm super motivated. I really want to learn sign. So it was a great opportunity all around. I got to meet some other people who do advocacy work, and the deaf and hard of hearing specialist, I think it was from San Gabe, right? She was great. She talked about her role as well. So it was just a great opportunity, and I'm looking forward to collaborating with some of those partners that we met and continuing to make change for our clients that are deaf of hard of hearing in the criminal justice system.
Thank you so much, Jordan. The scheduling got a little messed up today. I was at a legislative briefing this morning. The Department of Developmental Services meets quarterly with the legislature, and I was talking about affordable housing. I wasn't sure if I was going to be able to make it here today, and Jordan helped get this meeting together. And in the meeting this morning, I was talking about why representation is so important. Seeing people, being around people, understanding, the needs of folks, and it just doesn't happen unless you create opportunities. And so, over at our regional center, we've been trying to create these opportunities over the last couple of years, and we've really focused on it with the development of the deaf and hard of hearing specialist position at our regional center. And I just want to acknowledge you as service providers that all showed up for that vendor forum, and also that asked so many questions and participated. And that is not always the case. Sometimes we put on things like that and we don't have such an engaged audience. And so I just want to acknowledge that. Thank you. Tracy was there with me from Alta as well, and a number of our management staff. And just, again, want to acknowledge that. And then for the Being Michelle premiere, the importance of, especially when you talk about the intersection between mental health and individuals that are deaf and hard of hearing, and when you're talking about the criminal justice system and developmental disabilities as well, the role and the importance of the service coordinator is just, it cannot be minimized. And so I appreciate that Jordan drummed that into the presentation, that our role is really to support our service coordinators, because you really can't do anything else. This is something Jordan and I have been talking about for a long time. You're not going to participate successfully in your day program. You're not going to successfully be able to reside independently or in your home if you've got these forensic issues that are keeping you from being able to successfully do that. And so it's one of the many reasons why it's so important at our regional center. And that Being Michelle premiere really spoke to the importance, and I just want to say, of ensuring that we have interpreters. So I want to acknowledge our interpreters that come here and really work hard to keep up with how fast I talk in these meetings every single Friday. And again, it is absolutely important that people have the accommodations that they need to be able to make it through both our system, but also the criminal justice system. So appreciate that we created the environment for it. I'm so pleased that Lori decided to sponsor the event for Alta, and that the California Policy Institute put it on. And again, just want to acknowledge Michael for being part of that planning committee. What was discussed was just the importance of having people that are deaf being involved in the development of the whole event. And I had never been part of an event that had been developed that way, and I really appreciated it. Michael, I'd just ask you a quick question, if you know this answer. I believe that at one time we had 9 interpreters going at once in the theater. Do you know how many different interpreters we had at once inside the theater?
Okay. So there was 8 hearing interpreters, 6 deaf interpreters, and the hearing interpreters, they feed the deaf interpreters. So who you saw standing up on the stage signing, they were all deaf interpreters. And there was one on at the front of the stage, and the theater name was Crest Place. So it's a huge theater. There was a big audience. So that means all the way in the back for the deaf people who couldn't see if they were in the back of the theater, we did set up 2 interpreters in 2 different places, one on the stage, one in the middle for the audience. And then you also had to have your team interpreter, so they would switch. And then the hearing who was feeding the deaf interpreters. So really, they all of them did such a wonderful job. And it required a lot of patience in making everything work, and it was very successful.
Excellent. Again, and Michael tested this by sitting in the back of the audience to make sure that he could understand what was going on.
Yes, yes. Yeah, we tried so many different teaming situations, and we made sure that it was accessible for the entire audience.
Again, something that many of us have never experienced before, and I hope all of you get an opportunity to experience in the future. So again, thank you. I'm gonna move on to our next agenda item, which is gonna be about the budget. Oh, check that out. All right. Well, of course, the way things work, we get budget information right after Coffee with Community Services, so I couldn't share it last week. But we have had the budget deal come together over the weekend, and we have some information to share. And then I'm going to share my screen and provide you guys links so you have the information as well. In summary, the Trailer Bowl language has been solidified, and I'm going to kind of look at it, and then I'll share my screen so that you guys can get the more detailed information. So there's a statutory requirement for the development of the master plan for developmental services. Some of you are familiar that there was a developmental services task force previously. We are now having the establishment of a master plan for developmental services. And I will share also shortly that today is the last day to apply if you want to be in part of the work groups that they're going to be having. The implementation of the final phase of the rate models is January 1 of 2025. At this time, I'd like to acknowledge the advocacy of all of you service providers that really have worked tirelessly since the governor announced that he was going to be postponing this final phase of the rate study implementation. I will say our community of providers have been extremely active at a statewide level at this, and including getting partnerships with the regional centers, with the Association of Regional Center Agencies and others. But it really has been I feel like a provider-led advocacy effort through a lot of the different, California Community Living Network, California Disability Services Association, and of course the Association of Regional Center Agencies. They have made the determination to postpone the final implementation until January 1. What that means is all the things that I've been talking with you guys about for the last 3 months, all the things that we still don't have in order to be able to implement the rate study, we now have 6 more months for that to get figured out. I've had a couple different discussions with the department since the budget has come out, and my understanding is that a lot of the information that I've been talking with you all that we need in order to implement the rate study, the guidance, a lot of that has been written, but needs to be kind of finalized with the updated dates. With this, I will share that there has been a discussion from the state that they're going to offer stakeholder opportunities for you all to weigh in about the final implementation of the rate study. And so just wanted to share with you that that's one of the things they have discussed with us, is that they are going to be holding the meetings across the different service codes with the service providers to go over that discussion. With that, we're also looking at, in the final implementation of the rate study, getting the guidance for the quality incentive program and what that will look like too. And I'll get into that a little bit more here too. There is an allowance now for remote IPP, IFSP meetings if the individual has been seen in person in the last 12 months for IPPs and 6 months for IFSPs. They are going to allow the using of statistical practices to more efficiently complete provider audits. I can get into that a little bit more. Maybe Iqbal and I can talk about that once we get a little bit more guidance from the department around it. But it's in essence related to our provider audits and being able to use sampling to make determinations. And again, we can talk about that more in depth with folks. There's the elimination of the family cost participation and annual family program fees. And we know that that was something that regional centers and many folks have been supportive of for quite some time. Changing the timing of assessments for children who are provisionally eligible and updating social recreation statutes to include a requirement for identification of a regional center contact to DDS and training for some staff. Again, social recreation is something that is really, still continuing to expand within the regional centers. And so they're looking at ways in which we can, and I'm going to share my screen here real quick. They're looking at ways in which we can standardize and formalize a lot of the practices as we look to continue to expand it. You are all looking at, I'm hoping, the Association of Regional Center Agencies website. Yeah, I saw Tom Casper shake his head first. Right on, Tom. All right, and so what I want to click on here is I'm going to just grab this link right here, and I'm going to drop it in the chat for you all so that you have the specific language that has been posted. And then the reason why I'm sharing my screen and wanted to show it to you is that ARCA posts, the association, try not to use my acronyms here, the Association of Regional Center Agencies post a summary sheet. And I love Daniel from ARCA that this is what he has up here right now, which is that it's not quite ready yet, but it'll be available soon. So just wanted to put that out there. This is where it's going to be posted. It'll probably be posted, whoops, stopping my share, didn't mean to do that. It'll probably be posted shortly for folks so they can see the actual summary. For folks that have done this for multiple years with me, I don't post the ARCA summaries until ARCA puts them on their website. So not quite ready yet, but that's where they're going to be located. I do have some other additional things related to the budget that I want to go over. I do want to see real quickly just about the rate study implementation aspect of the budget, whether or not folks had any questions about that first before I move on to some of the other things that are going on related to that.
John, I'm just curious, with January being when the rates come out, I imagine you'll know when and what and who and how much prior to that. But it being December, that's kind of not a good. So are you guys shooting for something to be, like November maybe for us to know, or sooner?
I am shooting for July 5th, but I have no idea when DDS will give us the information to give to you guys. That's the challenge, is that, I would love to give, we've been through this before. So many of you have been providers and we're familiar with when we went through the original things that we had to do to implement the rate study. We went through the bundling and the unbundling of the rates. The idea of many of our rates contain multiple different activities that are going on within the authorization that we were writing. And so instead of, and I use this for those of you that, because this was my old service code for the early autism treatment programs, instead of just doing a 20-hour authorization that was for the therapy that included a number of different staff, the rate study in essence will say, no, moving forward, we're going to be unbundling that rate and we're going to be breaking apart the different specific positions. So for example, the tutor, there will be an authorization for the tutor. There will be an authorization for the lead. There will be an authorization for the behaviorist. So instead of 20 hours just in general for a vendor, they might get 15 hours of a tutor, 3 hours of a lead, 2 hours of that behaviorist. So we did all those activities before, and we recategorized you as service providers. And that's how we were able to figure out what your rate increases were up to this point. We will need to continue to do that last final aspect of that. And then also we're going to need to, then implement the quality incentive calculation as well, once the department very clearly lets us know what that quality incentive is going to be for the providers, which we still kind of are waiting for that aspect of it.
Right. And then the other thing is there's a couple programs where, it might end up with a lower rate. And so I know there's that hold harmless clause. I'm just wondering if once you hear, if there's anything that the vendor has to do, is there a form that we have to submit to be hold harmless and stay at the other rate, or is it something the regional center would have to do? So those are just kind of things that we've been talking about as vendors, That's
The
gonna,
hold, yeah, the hold harmless calculation is built into the spreadsheets that we
Okay.
receive, just like they were before, kind of like it's
Okay.
just an extra column now that they've added, which is like, here's now we figured out what the final rates are going to be. Now we're at this aspect of it, are they going to have a rate change or are they not going to have a rate change? It may be that they're going to continue on with that.
okay, perfect.
What we learned is that between now and when the rate study is implemented, we need to be mindful of new vendorizations for service codes that are in essence going away. We still have, I think, the authority to be able to do things like new 055 programs and give people rates. But we also know that in the course of doing that, we are going to have to be redoing those shortly. And we have talked to the department about this. We know that there's a number of service codes that are not included in the rate study. This has been a big, Jordan Eller's been really kind of talking to me about this quite a bit. Like we've got these service codes that are not included, like crisis intervention services or our service code 102, our parent and individual training service code. And we've got a number of ongoing services that are in those service codes that are not included in the rate study. So we're also working with the department on what that guidance will look like for the regional centers, because we're going to have to move people from service code to another service code. And then what does that mean for things like the vendor applications? What is that, like those types of things? So again, a lot of that, we have 6 months now to get those things figured out. And Michelle, these things cannot happen in November and December. I just want to share with you, this was explained loudly in the meeting that I was in with DDS just a few days ago, which is, we appreciate that you guys got 6 months, but we can't wait until December. And further, I will say, all of the DDS executive staff, including the director of DDS, who you may have seen in the picture, were at the Being Michelle premiere on Tuesday. And every one of them that I ran into over there, I said the same thing. We cannot wait until November and December to do these activities for our vendors. And so talking to, Ernie, talking to Brian, talking to those folks, we need to get these activities rolling here. So, okay, I'm gonna jump over to real quickly the other big activities that are going on. Again, the budget, lots of things that are going on legislatively. In the chat there's also something that Michelle dropped related to PAGA, which we can get into that shortly. I'm gonna share my screen with again, the information from the Association of Regional Center Agencies, which I really appreciate this. I don't know how much longer I'm going to get these updates because Daniel is leaving the Association of Regional Center Agencies, and he's the one that puts out this information. So with that said, if any of you feel like you would like to really support the regional center system, the developmental disability system at a statewide level through advocacy, I encourage you to apply for Daniel's job at the Association of Regional Center Agencies. If you have an interest in this, and you can look right here, and this is a web-based thing, I believe, so I can drop this in the chat, I hope, and then you can, actually I'll do it this way. I'll drop that, copy the link, and I'll drop that in the chat, and hopefully one of you might be interested in applying for this position. Again, it's going to be local here in our area. We absolutely rely on the support of Daniel when it comes to things like, legislative staffings. When I have to testify for, in front of the legislature, it's very helpful to have Daniel involved in giving feedback. Additionally, I wanted to share that the Master Plan for Aging has their 5 work group applications that are available. And so I'm going to drop the Survey Monkey in here. Today is the last day. If you are interested in participating in these work groups, I gave a huge pitch about it last time. The service provider voices are absolutely fundamentally important for us when it comes to the future of developmental disability services in the state of California. And you have an opportunity to be very impactful by participating in one of these work groups. And so for you as service providers, I would encourage you to do so. It's tough to say that your voice isn't being heard if you're not trying to participate in these types of statewide activities, so folks know how these policy decisions impact our clients and they impact you as business owners that are trying to serve our clients. Again, your voice is very important, so just want to encourage you guys to do that. All right, let's see here. Jordan, next up on our agenda, we have a vendor spotlight. And so I will,
That's
let's see,
correct.
we are introducing Brittany Harris.
Yes, Brittany Harris from Academics Academy. So Brittany, if I don't know if it's possible for you to turn on your video so we can see you.
Yeah, I actually have a video that I'm going to be showing. So
Oh, okay, great.
I'm going to share my screen and pull that up here.
Okay,
Perfect.
And can you guys see that?
we can. Thank
That's
you.
great.
Perfect.
I'm excited to introduce you to Academics Academy, where we empower underserved communities through emotional intelligence, computer literacy, and workforce development. Academics Academy is a community-based organization dedicated to offering comprehensive training and support. We focus on enhancing self-awareness and self-management to improve productivity and relationships while equipping individuals with skills and certifications that provide a competitive edge in the workforce. Our mission is to bridge the gap to high-skilled jobs by providing essential training, career guidance, and mentorship. Our core outcomes focus on addressing client self-awareness and self-management skills. This approach helps individuals lead healthy and productive lives while successfully interacting with family, friends, and professionals. We offer 3 key programs: emotional intelligence, computer literacy, and workforce development. Each program is designed to equip individuals with the skills they need to succeed. Emotional intelligence, or EQ, enables individuals to understand, manage, and navigate emotions, fostering resilience and enhancing interpersonal relationships. Strong EQ improves stress management, communication, and teamwork, crucial in leadership and personal growth. Cultivating an emotional intelligence leads to a more fulfilling life and healthier relationships. Our computer literacy program equips individuals with essential digital skills, making technology accessible and enhancing employability in today's job market. Certifications validate skills, enhance credibility, and open doors to career opportunities. They serve as a standardized benchmark, setting certified individuals apart in competitive job markets. With increased confidence and recognition, certification fosters professional growth and industry standardization. In addition to our core programs, we offer tailor-day sessions that can be customized to meet the specific needs of the individual or group, ensuring that participants receive the most relevant and impactful training. At Academics Academy, we embrace person-centered thinking as a guiding principle. This approach ensures that each individual's unique needs, preferences, and goals are at the forefront of our support and training programs. Our team is trained in person-centered thinking methodologies, allowing us to provide personalized attention and support to every client we serve. By empowering individuals to take an active role in their learning journey and career path, we foster an environment of respect, empathy, and collaboration. Our certification programs offer a gateway to career advancement validated by industry standard assessments. Collaborating with Pearson VUE, we ensure the credibility and accessibility of our certifications. Tailored to individuals at every skill level, our courses provide comprehensive training in diverse fields. Each course is priced individually, offering flexibility to tailor your learning journey to your specific needs and goals. Let's explore one of our most sought-after certifications, the Microsoft Office Specialist Program. This certification stands as a beacon of industry-leading assessments evaluating skills and knowledge in Microsoft Office through project-based testing, ensuring a comprehensive understanding. With over 3.9 million jobs in the United States alone annually seeking Microsoft Office skills, this certification becomes an indispensable asset, enabling individuals to shine in the competitive job market while streamlining daily tasks and fostering professional advancement. What makes MOS certification truly stand out is its endorsement by Microsoft, cementing its status as the premier validation of Microsoft Office skills. This certification provides versatility and credibility to professionals striving for excellence in their careers. Another popular certification is our Adobe Certified Professional Program, a hallmark in the industry recognized for its validation of Adobe Creative Cloud proficiency and essential skills for digital media careers. Delivered by Certiport, each certification is intricately tied to a specific Creative Cloud project, ensuring mastery of relevant software tools. Designed by experts and integrated with Adobe applications, the exams provide an authentic assessment of job-ready skills. Whether pursuing visual design, video design, or web design, Adobe Certified Professional certification equips individuals with the expertise needed to excel in their chosen field. We invite you to get involved with Academics Academy. Whether you're interested in participating in our programs, referring clients, or partnering with us, please reach out through the contact information provided. We can also visit our website for more details. Thank you for your time. Together, we can empower communities one individual at a time. We look forward to working with you.
Oh, cool. Thank you so much. Brittany, anything else? That was awesome.
I think I pretty much covered everything in there. But I definitely, if you guys have any questions, I can definitely I can put the website in the chat, and I'll also put my email in there. I would be the main contact for our program here. So if you have questions, anything like that, I can definitely answer those for you.
That is awesome. We're going to have your contact information in the chat too. Perfect. Excellent. I want to go into the chat real quick and just comment on, Jay had asked a question, I believe, about the master plan for developmental services and when they're going to be making the selections. My understanding is that there's been a significant amount of applications that have been submitted to the state of California for positions within the work groups, and so they will be probably going through those probably for a little while here, I would assume. But they have not set a date for when they want to get it done. If anyone knows that, let you know. But I will tell you, I will likely probably apply to be on one of them at some point today, but just not sure where it'll land. Alrighty. Let's see here. Let me see if there's anything else in the chat before I move on to my next item. All right. Again, the service provider directory, I think I mentioned a little bit last week that we are just still waiting for the department to get that kind of cleaned up before it gets clarified how it is going to be specifically utilized by the service providers and by the regional center. Right now, our understanding is that the department, the way this works is that the department is downloading all the information from the regional centers about service providers, all the information that our staff have been entering in for, I don't know, last 20 plus years that are in our system. As you can imagine, the data that's been entered in over that period of time, even just at Alta, there may be some of our staff have noticed some inconsistencies in the way in which we enter data into our own SANDIS system. Well, now multiply that by 21 regional centers, and you have a whole lot of different ways that people use different fields within the system. And so right now, the department is kind of cleaning and grooming all of the information to make sure that it makes sense when it gets uploaded into one singular service provider database. So that's what's going on right now. Apparently it's turning into a little bit more of a lengthy process than they thought it was going to because of some of the mismatched information, but they believe that this will be very important to ensure that we have the most accurate service provider directory possible. Again, as it relates to quality incentive program and rate reform, the department has expressed to us that they're going to distribute additional guidance about how the provider directory will work into the, again, quality incentives, which is the last 10% of the full rate study implementation. Again, like between over the next 6 months, there's just a lot of discussion we're going to have with you as service providers so that you understand the last part of the rate implementation, especially if you're a new provider, you were vendored before, and didn't go through the previous activities. So just bear in mind, we will make ourselves as available as possible once we receive all of the guidance from the Department of Developmental Services. All right. Jordan, let's see. We've got up next an HCBS update from Scott.
All right. Well, I've got another nice report here. We've got 383 sites that have been seen out of 513. That's our full number now. So that brings us to just a hair under 75%. I wanted to just go over a couple of the common issues that we're seeing because we're going to get down to the wire here. And there's obviously 25% of our facilities and homes that still need to be reviewed. And so the common issues that are kind of popping up here are really that cameras are sometimes inside the homes, and cameras are not allowed inside the common areas of care homes. And so taking those down is part of that remediation process. Additionally, access to snacks. Just making sure that there's food out that can be accessed, that people don't have to ask for a snack that it's available to them. And then bedroom door locks. We've talked about these a lot. We do require it to be an auto release lock to be, it's actually not HCBS required, but to remain in line with fire code, you want to have an auto release lock, one that pops open when you open it. And then they also have to be individually keyed. That's another sticking point. Now, as we get to the end of this, the review period, we're going to have 30 days to remediate any plans that are outstanding. And so if one of your programs happens to get a site review in August, you are going to still get 30 days to remediate if needed. But I will remind you all that we're hitting between 82 and 85% of initial compliance, HCBS compliance upon that initial visit. So we're doing well. We're tracking for completion by the end of August. That's all I've got.
Excellent. Thank you very much, Scott. A great work being done by our team, and we're making our way towards August. We'll get there soon enough. All right. Let's see. We have Jordan up next.
Yes.
Program.
Yeah, so I'm going to share my screen so you guys can see the flyer, and I'm going to put it in the chat right now so you guys have access to that, but let me share my screen. So we have a free, now I can't see you guys, but okay, so we Turning Point START, right, is a community linkage program here at Alta Regional Center that really focuses on working with our duly diagnosed population that have co-occurring mental health disorders. And part of their contract with us is to provide, right, with the Center for START services, provide training opportunities, free training opportunities for our case management staff, our vendors, and external stakeholders that could benefit in that. So they have a great caregiver educational group coming up and support series. So if you are a caregiver and you are looking to learn more about mental health services, this will be a great opportunity for you. It's going to be an 8-week series, right? They have groups starting on July 9th and July 10th. It is going to be hybrid, right? So they're trying to save the spaces for the hybrid for the people who might be in some of our outlying areas, right? Some of these towns and counties that they've listed, towns that they've listed down here. And then so it's 15 in-person, 15 hybrid. You can see the schedule here. It's easy to register, right? We have the registration here. And then the bulk of the curriculum that they're going to go over. So the first week, they're going to talk about mental health and mental health disorders, right? Really discussing the different types of treatment that's utilized for specific symptoms and diagnoses of mental health disorders. The second week, they're going to focus on executive functioning, right? Gaining understanding of different sets of skills that are necessary for the process of cognitive control of behaviors. And then on the third week, looking at trauma, right, and intellectual developmental disability. So really learning more about trauma and how early childhood trauma changes the development, right, in one's cognitive, physical, and emotional growth. Week 4, common mental health disorders and symptoms. So focusing more on some specific mental health diagnoses. And then the different treatment that can be utilized. Week 5, looking at challenging behaviors. Week 6 is medical conditions and the impact on their overall well-being, right? Really increasing our knowledge and understanding as to how medical conditions can impact one's mental and behavioral health symptoms. Week 7 is cultivating wellness with strengths and PERMA. And then week 8 is the introduction of psychiatric medication management, right? And really encouraging folks to bring questions. They want to be able to answer those questions. And again, this is a free opportunity, right, for caregivers, whether that's parents, families, sisters, brothers of somebody who's developmentally disabled, or even a vendor, right, who provides care. So hope that you guys will take advantage of that free opportunity and learn more about supporting clients with dual diagnosis needs with mental health and IDD. Any questions on that? Jana Cooper, she's the one from Turning Point who shared the flyer with us. So I put that there. We hope you guys will get signed up. The next thing that I have to share, which is very exciting, as we're wrapping up this week, we are completing our contract awards for our community resource development plan. and our community placement plan. Are you guys seeing my screen okay? All right. So the exciting projects for this year, I know that you guys have probably heard John talk about some of our multifamily housing projects, which is just so exciting. And I'm sure you talked about those this morning, John, earlier with the legislature. So we have the Chelsea River City Apartments. That's going to be 17 units in a multifamily housing project. Brilliant Corners, we had purchased a lot there. Another multifamily housing project with Mercy Housing. That's going to be the Heights on Stockton. We're fortunate to be getting 10 units at that development. This year, we are also looking for another enhanced behavioral support home, right? The advanced behavioral support homes require us to work with a housing development organization, which Brilliant Corners was awarded this year to help us purchase the home. And then WellCare number 6 was the provider who was selected to provide the ongoing service in that. That is an adult enhanced behavioral support home for individuals either stepping down from restrictive settings or stepping down from things like community crisis homes, maybe a state operated facility. So looking at a step down option for people who are in more restrictive settings. We are also excited that Family In Care was awarded the residential care facility for the elderly. That's going to be a specialized residential facility for the elderly. We have our local FMS, right? The financial management services. So the local award was $75,000 and that went to Ridgeline Pediatrics. That's a new service for them. We're excited to be working with them on that. For the center-based out-of-home respite center, we have awarded that to UCP of Sacramento in Northern California. In regards to the psychiatric services, we have vendored with DIMPNA Psychiatric Nursing and Wellness. So excited to share that resource once that comes out. Our 12th project was looking at substance use disorder and really increasing the access, right, for our clients to substance use disorders. So we have contracted with Lori Ann Eldridge LLC to help us develop. She will be developing training materials and some curriculum, right, to really enhance our local stakeholders, like healthcare providers, vendors, and our case management staff about really the importance of the curriculum and developing resources for the providers to really increase our clients' access to substance use disorders, right? Many times when our clients are trying to participate in the generic programs, they sometimes are unable to break down the curriculum in a way that they would need to be able to process that information. Many of our clients also benefit from, some of them do benefit from the group setting for substance use disorder treatment, but some of them will also need more of a one-to-one setting for that. And not all generic programs are able to provide that. So we're really looking at adapting curriculum to really help our clients access that material successfully. We were excited that On My Own was awarded our housing access services project. And then we also, for the enhanced supported living services, that has been awarded to Community Anchor. Now for the statewide FMS, John, I don't know if you want to talk about this. I know that this is your.
Yeah, I can go through these real quick.
Okay, cool.
And Dan can help me if I mess it up. So we, Alta California Regional Centers, entered into contract with 3 different agencies to expand financial management services to Northern California. With this, the awards are for Acumen Fiscal Agent. This Acumen is currently a service provider of the regional center, offering financial management services for the sole employer model. We have an award that we are doing here that is going to help them establish an electronic enrollment system. The goal of this system, once it's completed, is to move the onboarding from an average of 90 days down to an average of 30 days for FMS. We believe that that's going to be hugely impactful for our clients, their families, once we are able to get that implemented with them. Additionally, though they don't do the co-employer model for the financial management services, once they establish their electronic enrollment system, they are going to be offering that electronic enrollment system to the other FMS agencies that are offering that model as well. Additionally, they will be expanding their kind of footprint in our area by having an additional Northern California fiscal agent that will be supporting our population up here. And Dan and myself worked into some deliverables where all of these agencies will be doing kind of a road tour. So quarterly, they will be available for in-person intakes in each of our Northern California catchment areas for anyone that may want to meet with the actual agency themselves in person. So they will be doing in-person office hours. Additionally, they will be meeting with regional center representatives quarterly too, just to talk about the status of referrals, making sure that all of the supports are going on. And then they'll also be meeting with Dan and I to talk and make sure that all of the deliverables and the funding are leading towards their ultimate goal, which is to serve an additional 150 individuals with FMS services by the end of the term of the contract. So not only are we doing the electronic enrollment, but we are also looking at the expansion to serving up to 150 individuals, positioning themselves with staff, etc. We believe that there's a likelihood that they will be able to serve many more than that. But again, we want to look at an expansion here in Northern California, specifically through these funding. For HR Alliance, they are not an existing FMS provider in the state of California. They currently serve in Michigan, where they are experienced in administering the self-determination program. They're going to bring their expertise to Northern California, and we've set up a similar deliverables as far as their availability. They will be establishing a local office here in our area. They will be going around to the different catchment areas as well, and they will be setting a goal to get staffed up to be able to serve 100 individuals through FMS by the end of their contract term. Very similar for Ridgeline contract deliverables. In their case for Ridgeline, again, another 100 individuals that we are looking at getting served. And in this case, Ridgeline is an existing pediatric day health center provider for our regional centers. So they are currently vendored, and they are looking to expand into our area for FMS services. And again, I would share for those of you that are familiar with the needs of our clients, both HR Alliance and Ridgeline have indicated that they will serve both the co-employer model and they will do FMS nursing as well. So we know that that's a big need. We would share with folks that, and I don't know if they're on the call here because I don't think they typically participate, but GT Independence has indicated as of last week that they will take no further referrals for co-employer for self-determination at this time. And so with that, the need to get these folks into contract and get them vendored is extremely important. And I want to acknowledge and appreciate Dan and also Christy Schaefer from Jordan's team that have really worked hard to operationalize not only the request for proposal process on extremely short time frames and notice, but also that we're able to get into 3 different types of contracts that really are trying to meet the needs that were identified by our population. And so again, I just really want to acknowledge the staff support that went into us being able to do this. For those that have heard me talk about FMSs, I am not knowledgeable about FMSs. I'm not necessarily super knowledgeable about self-determination the way I need to be. I cannot say enough about Faye, our Associate Client Services Director, who sat in all the interviews and made sure that all the selections that we made were aligned with what the needs of our agency are and what we're hearing from our population. Helen and her staff supported us in reviewing the applications, as did Jordan, because we received quite a few. We received over 50 applications statewide for this. Michelle Ramirez.
I was just curious, for those of us that are currently doing FMS for social rec, is the goal to eventually move those clients to these new agencies, or is this just expanding what we're already doing?
I think it's really expanding. I think at this time, we know we have huge needs on the FMS side for social recreation, but we also have the huge needs for the self-determination program and being able to get these large budgets accommodated, etc. So yeah, it's really trying to just expand. And I'll be honest with you, Michelle, I would love to propose something like this again. I feel like we're a ways away from having the resource needs to truly support the state's ambitions for individualized, personalized services that can be led by the client and their planning team instead of the regional center. And all of those things have to be run through FMSs. And then also we have the ability to do the social recreation payments as well, right? So it can be quite a challenge, making sure that our participant directed services needs are met, that our, PIP and CIE needs are met through the FMSs, the social rec needs are met, and then all of the different types of needs for, individuals participating in the self-determination program. I'm very pleased that we were able to get this done in this short time frame, and just really looking forward to, again, maybe getting these folks vendored as quickly as we can and having these immediate options for folks to be working with. Jordan, we have a events calendar, and folks are well aware of that, but I do want to share a big event, which is that next Friday we're not having coffee with community services. Alta California Regional Center. Michael already wished you guys a happy 4th of July, but I will do it again. That a happy 4th of July to everyone, and our office will be closed next Thursday, but we are going to close next Friday. I do want to encourage folks to please check out our events calendar of all of the upcoming things that we have. Hubert, my God, I said Hewitt, and I have not done that in quite some time. Hubert, you've put out some information, I think, about us staying cool, and it's going to be sent out via email to all those folks that are subscribed onto our website. Did we get an Everbridge notification too, or are we at that point?
We are not at that point yet, but I will send out a MailChimp email as well.
Oh my gosh, and thank you very much for that. And we didn't even have Michelle Deshane talk about the DSP stipend, because poor DDS just abandoned us with all of our activities of trying to promote the DSP stipend by no longer letting us know what our numbers are. That being said, the DSP stipend, you have 2 more days to get this thing knocked out, right? Or 3 more days, however many more days are left in this month.
3 more
3
days.
more days. All right. So please, for those of you that have not done it, get yourself logged in, get yourself completed. Jay, let's get one more staff person paid with the DSP. If there's any staff that haven't done it yet, let's get them on that DSP stipend this afternoon, get them approved, and get a check in their pocket, and better train staff. Appreciate everyone for all of your hard work at this fiscal year. It's been certainly a challenging one as we continue to come out of COVID and deal with challenging budget situations. So appreciate all of you. Thank you very much, and hope everyone has a great weekend. We'll look forward to talking to folks in 2 weeks. Jordan, yes.
Yes, I'm sorry. I just saw that the flyer that I had shared about the caregiver group is not shareable. Christy Schaefer, did we get any other link from Jana Cooper at Turning Point?
It's all good. We're gonna send it out via MailChimp to everyone that's
Okay, perfect.
subscribed
Okay, cool.
get it over to Herman, and he'll send it out to everyone that's on our list.
Okay, we'll do that. Thank you.
All right, folks. You guys have a great rest of your day. Great weekend.
Bye-bye.